What are sinuses and how do you fix problems associated with them? First, they're pockets of air inside the bones of the head, and they're designed to make the skull lighter. They're lined with the same mucous membranes as the inside of your nose. When sinuses are inflamed, they can cause difficulty breathing through the nose, postnasal drip, decreased smell, facial pressure and pain, and just a sense of being down. If you've had more than 3 months of these symptoms, you may have chronic sinusitis. Chronic sinusitis is diagnosed based on symptoms and evidence of inflammation. During an appointment, your ear, nose, and throat surgeon will look for signs of this inflammation in your nose by using special endoscopes as well as three-dimensional x-rays called CT scans. How do we treat chronic sinusitis? Let's talk a little bit more about what it really is. The underlying cause of chronic sinusitis is actually inflammation, not infection. Inflamed mucous membranes block the drainage pathways from the sinuses, causing mucus to back up and stagnate. This backed up mucus can't drain. Bacteria then grow, producing an infection. This is why steroids, which tamp down the immune system and the resulting inflammation, can often work better than antibiotics at relieving symptoms. So, treatment is geared towards decreasing nasal inflammation. I start patients on a nasal saline irrigation, a nasal steroid, and an oral antihistamine. Using nasal saline irrigation, such as a neti pot or a Neomed irrigator twice daily, flushes out stagnant mucus. It also washes out allergens such as pollen, cat dander, and dust mites before they have a chance to cause inflammation. After rinsing the sinuses, my patients then use a nasal steroid spray. These are very low-dose, over-the-counter steroids that decrease inflammation. Thirdly, oral antihistamines prevent the allergic reaction and the inflammation from happening within the immune cells. Remember, these treatments are best when used daily on a schedule for at least 6 weeks. It's very difficult to keep inflammation down in the long term when they're used only as needed. Remember to ask your doctor when you have a flare-up because antibiotics or oral steroids might be helpful. When these treatments fail to help, other medications or sinus surgery are options. The goal of sinus surgery is to open up the drainage pathways so that mucus can drain. Opening the sinuses also allows medications to more easily get to where they need to be. Sinus surgery won't cure, but it can significantly improve the quality of life. Remember, facial numbness, nosebleeds, pain, or difficulty breathing out of one side of the nose are not common sinus issues and really should be evaluated by an ENT surgeon. If you have any questions, please contact us. We'd love to help you out with your ENT problems.